SLC25A32 mutations are riboflavin-responsive exercise intolerance.
As we said earlier, fibromyalgia is a disorder of metabolism, meaning our bodies become very, very inefficient at producing energy. So the more we can do to facilitate energy production, the better we're going to feel. This is why exercise does help with these symptoms. One of the keys to the diagnosis oftentimes of both thyroid disease and fibromyalgia is exercise intolerance. That exercise intolerance is oftentimes secondary, if not alone, or not due just to thyroid dysfunction alone, could be secondary to the underlying. Drugs have a place, yes, that's for sure. There's no denying that, but all these other things should be tried as well. A couple other things that are certainly well worth trying if you suffer from fibromyalgia and indeed many forms of chronic pain. Know that certain forms of phototherapy or photomedicine, as it's called.
Well, studies show that the exercise is very important to make a diagnosis of the disease, and also there are drugs that may be under treatment. The application is to the use of riboflavin, that is a drug that we're going to check it out later.
Lifestyle medicine is the use of lifestyle interventions directed at the treatment, management, and prevention of disease.
Hey folks, Dr. Keel here, and I want to take a few minutes to talk about riboflavin and its potential health benefits. Riboflavin is a water-soluble vitamin, also known as vitamin B2, that is typically included as part of a vitamin B complex. The name comes from the term ribose, which is a type of sugar, essentially, and flavin, which means yellow. Riboflavin is essential for the proper development and function of skin, maintaining the lining of the digestive tract, healthy blood cells, and many other functions. It's needed to break down carbohydrates, protein, ketones, and fat, and it also makes it possible for oxygen to be utilized properly by your body. It has many potential benefits. It may help reduce the risk of certain types of cancer, including esophageal and cervical. It may reduce muscle cramps, immune system boosting, preventing AIDS.
Well, as you see, this drug may be used for many things, but in this case, it's going to be used for the treatment of this disease. Definition: we report on a 14-year-old girl who represented with recurrent exercise intolerance. She had biochemical features of multiple acetylcholine dehydrogenation deficiency, but she did not have mutations in ETFA, ETFB, or ETFDH. Oral supplementation with riboflavin led to dramatic improvement in the clinical and biologic abnormalities. So this is how the exercise can be used in the diagnosis. At the beginning is slow, but later it's going to be faster. You see the girl starts coughing. Well, that's the exercise or the diagnosis. Pros and cons. And maybe prevent migraine and head chase, antioxidants, anemia, and anti-carcinogen. And the cons: the precursors of flavin adenine dinucleotide. The cofactor for electron transfers, flavoprotein, and electron transfer flavoprotein ubiquinone oxidoreductase.
Riboflavin, vitamin B2, is required for energy, for healthy skin, and the prevention of cataracts. Hi, I'm Dr. James Machino. You know, riboflavin, or vitamin B2, is a yellow-green fluorescent pigment. That's why when you take supplements that have fairly high doses of B vitamins, your urine becomes very bright yellow. That's actually proof that your body absorbed the vitamin, processed it, and then the kidneys filtered some of it, either as an end product of metabolism, steroid hormones in the body, for red blood cell production, and it's required to activate vitamin B6 and the B vitamin folic acid. In other words, if you were to get folic acid from seborrhea, flaky skin in around this nasal labial fold, an inflamed mouth and tongue, supplementation studies with vitamin B2 shows that it's very important for prevention of migraine headaches, to help manage cataracts and prevent them, for aphthous ulcers or cancer.
Well, that's what I already said at the pros and cons. In conclusion, a patient with haploinsufficiency of SLC25A32, a deficiency of FAD, mitochondrial transport cause late onset exercise intolerance associated with abnormalities in the acylcarnitine profile. The patient's symptoms appear to be highly responsive to oral supplementation with riboflavin. Our findings underscore the importance of studying genes involved in riboflavin metabolism in such patients and expand knowledge of the spectrum of inborn errors of riboflavin transport.
Have you been eating enough of your essential vitamins? What do you mean you don't know? Let's talk about how much you need to be eating so you can make sure that's what you're getting. Let's see if you're adding enough vitamin B2 in your diet. This B-complex vitamin is also known as riboflavin, which our cells use as a series of coenzymes to break down fatty acids into energy to produce compounds such as vitamin A, niacin, vitamin K, and neurotransmitters. It's also used not only to make, but to activate vitamin B6 in our bodies. So you better hope you're consuming enough of this. The recommended daily allowance for adult females is 1.1 milligrams per day. And for when you're deficient, it's called ariboflavinosis, which is usually associated with other deficiencies of vitamins. There are many symptoms of ariboflavinosis like sore throat, muscle weakness, cracks or sores on the outsides of the lips, inflammation of the mouth and tongue, and moist, scaly skin.
Well, those are the things that may happen with the no presence of riboflavin, as we already said. So that's it. Thank you.